clinical research and clinical trials are done so that we can improve upon our current day standard. And when patients participate in these studies, we learn more and we get better. Our patients need to participate in these trials so that we can increase our scientific knowledge. But most patients do not participate in clinical trials. And in our minority population and certain ethnic populations, the participation in clinical trials is even lesser. There are many reasons for it potentially. There are certain cultural reasons, and there are certain institutional reasons why people do not participate in clinical trials. I think as medical communities, it is our responsibility to encourage participation in clinical trials. We need to educate our patients better, especially our minority population better, to participate so that we can improve upon their care. For example, the African American population and breast cancer. We know that the survival is poor in these patients, in this ethnic unique population. Even though the cancer incidence, breast cancer incidence is lesser, they do poorly. In general, they have poor survival. They do not appear to respond very well to treatments at times. Why? And I think the answers will be answered only through participation in clinical trials. Now, national organizations such as National Cancer Institute, American Society of Clinical Oncology, the American Cancer Society, the Komen Foundation, etc., have been trying this to some extent, but I think we need to do more. And that's how we can institutionally encourage our patients to help. Maybe we can provide more financial support to these trials. I think it is extremely important for patients in certain minorities to take charge, and I think this is one of the ways they can take charge. And I think we can improve upon it with a better community participation in these programs.